Good afternoon, everyone. I'm Jennifer Walsh. I'm a Senior Media Officer with the Institute of Medicine and National Research Council. I want to thank you all for joining us here today, those of you joining here in the room this afternoon, as well as those joining via the webcast. This is a discussion of the new report that was just released, Confronting Commercial Sexual Exploitation and Sex Trafficking of Minors in the United States. This report is now available, and it can be downloaded as a free PDF along with video and other related materials at www.iom.edu and www.nas.edu. This will be an approximately 1-hour briefing unless we run out of questions beforehand. We will start with some opening remarks and introduce the study and then give an overview of the report's findings and recommendations. We will then open the floor up to questions. Those of you in the room are asked to go to the microphones on either side before asking a question, and those of you watching the video webcast can also ask a question by submitting a question in the Q&A text box and clicking the submission button that is located under the player. We ask everyone that asks a question to please identify themselves and their organization. And with that, please let me introduce Clyde Bainey. He's the interim Leonard D. Schaefer Executive Officer of the Institute of Medicine.
Good afternoon. I'd like to welcome you and thank you for joining us at both the webcast, for those of you doing that, and people present in the room for the release of our report confronting commercial sexual exploitation and sex trafficking of minors in the United States. Commercial sexual exploitation and sex trafficking of minors are frequently overlooked, misunderstood, and unaddressed domestic problems. In the last decade, they have received increasing attention from advocates, the media, academics, and policymakers. However, much of this attention has focused internationally. This international focus has overshadowed the reality that commercial sexual exploitation and sex trafficking of minors occur every day within the United States. The Department of Justice, Office of Juvenile Justice and Delinquency Prevention asked the Institute of Medicine and the National Research Council to examine what is known about these problems and what the evidence offers by way of solution. The report is the culmination of that committee's, the examination of that topic. I'm very pleased to introduce the committee co-chairs, Dr. Richard Krugman and Dr. Ellen Wright Clayton, who will present the key findings and recommendations from the report. They're joined today by fellow committee members Abigail English, Sharon Lambert, Callie Ranison, and Jonathan Todres. I'd like to take this opportunity to thank the committee for its excellent work on this difficult subject. Their efforts were supported by an outstanding team of project staff led by Patty Simon, and including Tara Minero, Pamela Atai, and Alejandra Martin. Special thanks are also due to Kimber Bogard and Arlene Lee for their oversight and guidance on this project as board directors within IOM and the NRC, respectively. Finally, I'd like to thank the Office of Juvenile Justice and Delinquency Prevention for their support of this work, and especially for their ongoing commitment to address the complex public health and public safety issues surrounding this urgent topic. Now I'll turn the program over to Drs. Krugman and Clayton.
Thank you very much, Clyde, and I want to add my thanks to all of you for joining us today here and on the webcast. And I too want to start by adding my thanks to what was an extraordinary group of individuals to work with on the committee, to my co-chair, Ellen Clayton, to our staff, and to the Department of Justice, Office of Juvenile Justice and Delinquency Prevention, hereafter known as OJJDP. Let me start this by providing context on the report, and that context is this. Commercial sexual exploitation and sex trafficking of minors include a range of crimes committed against children and adolescents, including trafficking a minor for the purpose of sexual exploitation, exploiting a minor through prostitution, and exploiting a minor through survival sex. Put simply, the commercial sexual exploitation and sex trafficking of minors are an often overlooked, misunderstood, and unaddressed form of child abuse. Commercial sex and sexual exploitation and sex trafficking of minors may be underreported or undiscovered. The victims may not be recognized. For example, these crimes may be overlooked or underreported because they frequently occur at the margins of our society and behind closed doors. Their victims are often vulnerable, and the children who are vulnerable are those who have been neglected or abused, those who have been in foster care or juvenile detention, and those who are homeless, runaways, or so-called thrown away as children and adolescents who are asked to leave their homes and who are not like runaways just running away from their homes because they're being abused. In addition, many professionals who interact with these youth, such as teachers, healthcare providers, child welfare professionals, and law enforcement professionals, are often unaware that commercial sexual exploitation and sex trafficking of minors occur in their communities. As Clyde said, people think this is an international issue, but not one here. It is misunderstood because minors who are victims of commercial sexual exploitation and sex trafficking in the United States are often arrested and treated as perpetrators under state criminal and juvenile delinquency laws that make a wide variety of sexual offenses illegal. Although victims themselves, these children and adolescents may be subject to arrest, detention, adjudication or conviction, commitment or incarceration, and to having permanent records as offenders. It's unaddressed because few professionals and systems that are responsible for protecting and serving children and adolescents are adequately prepared to prevent, identify, and respond to these problems. Further, broad consensus exists among professionals in each sector that serves victims and survivors of commercial sexual exploitation and sex trafficking that there are too few services available to meet current needs, and that services that do exist are unevenly distributed geographically, lack adequate resources, and vary in their ability to provide specialized care to these victims and the survivors of these crimes. The committee put together this slide as a part of our overarching thought process around this issue. This is an emerging area of research and practice. As such, there is a lot that we still do not know. However, the committee found evidence that commercial sexual exploitation and sex trafficking of minors are multiply determined with risk factors at several levels as depicted in this slide. These include individual level factors such as a history of abuse or neglect or maltreatment, family, peer, neighborhood, or community factors such as family disruption, peer pressure, or social isolation, and societal factors such as the sexualization of children. Adding to this complexity, each of these factors interacts within and across levels to increase risk or protection. This is important because it suggests that prevention and intervention efforts targeting only a single risk or setting may have limited utility. In addition, the committee found evidence that victims and survivors of these crimes face immediate and long-term social, legal, and health consequences. Exploiters and traffickers who often operate undetected or without serious penalties contribute to and benefit financially from the exploitation and abuse of minors. People who purchase or trade for sex with underage individuals engage in and help fuel demand for exploitation and abuse of minors. Individuals and businesses that look the other way or actively facilitate commercial sexual exploitation and sex trafficking of minors enable and perpetuate these crimes. Finally, in the committee's view, a nation that is unaware of these problems or disengaged from solutions unwittingly contributes to the ongoing abuse of minors and all but ensures that these problems remain marginalized and misunderstood. Although a modest amount of research and noteworthy policies and practices have emerged, far more needs to be known in order to adequately understand and address commercial sexual exploitation and sex trafficking of minors in the United States. Recognizing this challenge of addressing commercial sexual exploitation and sex trafficking of minors in the United States, the Department of Justice's OJJDP requested an in-depth, independent examination of these problems. You asked us to consider the scope and severity of the problem, causes and consequences for both victims and offenders, experiences among populations served by child welfare and juvenile justice systems, any evidence associated with prevention and intervention efforts, lessons learned through international, national, state, and local advocacy efforts, and the adequacy of current state and federal laws. Finally, OJJDP asked the committee to make recommendations in the following areas. 1, strategies to respond to commercial sexual exploitation of U.S. minors, including policies and practices for human services, healthcare agencies, juvenile justice agencies, law enforcement, and the judiciary. 2, new legislative approaches if necessary. And 3, a research agenda to guide future studies in the field. The study committee included 13 members listed on this slide with expertise in women's, adolescent, and pediatric health, criminal and juvenile justice, law, child welfare, human services and victim services, statistics and measurement, I'm sorry, I should have looked behind me. There we go. Statistics and measurement, psychology, sociology, nursing, social work, public health, health disparities, and technology. To complete its work, we met 6 times in person and held 2 public workshops to obtain vital input from a broad range of relevant stakeholders. In addition, small groups of committee members and study staff participated in a series of regional site visits to learn about the efforts of a range of organizations in different parts of the country with different populations. These site visits included in-depth discussions of local challenges and noteworthy practices. And as you can see on this slide, we went coast to coast. We were in Boston, San Francisco, Chicago, and New York with the 4 regional site visits. And all of that has led up to the report that's being issued today. This report is organized in 3 parts. Part 1 provides a foundation for understanding the commercial sexual exploitation and sex trafficking of minors in the United States. It includes an overview of the nature and extent of these crimes, an examination of risk factors and consequences, and a review of current laws. Part 2 examines current and emerging strategies for preventing and identifying these crimes, for assisting and supporting victims and survivors, for addressing exploiters and traffickers. And this includes a review of efforts in health and healthcare within victim and support services, in the education sector, by the legal system, and by the commercial sector. And finally, Part 3 offers recommendations designed to increase awareness, advance understanding, and support efforts to prevent, identify, and respond to the commercial sexual exploitation and sex trafficking of minors in the United States. During its deliberations, the committee formulated a set of principles that guided these deliberations and the consideration of the recommendations that Ellen will be presenting shortly. The guiding principles state that commercial sexual exploitation and sex trafficking of minors should be understood as acts of abuse and violence against children and adolescents. That minors who are commercially sexually exploited or trafficked for sexual purposes should not be considered as criminals, and that the identification of victims and survivors in any intervention, above all, should do no further harm to any child or adolescent. Next, the committee reviewed the existing literature, governmental and non-governmental reports, research from related fields of practice and study, and testimony presented during the committee's workshops and site visits. After reviewing the evidence, the committee came to the following overall conclusions. One, there is substantial and compelling evidence that commercial sexual exploitation and sex trafficking of minors in the United States are serious problems with immediate, long-term, and adverse consequences on children and adolescents, as well as for families, communities, and society as a whole. Two, efforts to prevent the commercial sexual exploitation and sex trafficking of minors in the United States are essential, but largely absent. And third, efforts to identify and respond to the commercial sexual exploitation and sex trafficking of minors in the United States are emerging, with some noteworthy examples. But efforts to date are largely undersupported, insufficient, uncoordinated, and unevaluated. Efforts to prevent and identify and respond to commercial sexual exploitation and sex trafficking of minors in the United States require collaborative approaches that build on the core capabilities of people and entities from a range of sectors. And finally, efforts to address commercial sexual exploitation and sex trafficking of minors in the United States need to confront demand and the individuals who commit and benefit these crimes. Now I'd like to turn over this presentation to my co-chair to present the recommendations. Al?
The committee made recommendations in 5 key areas. It's important to increase awareness and understanding. This is absolutely essential, and I'll say more about it in a minute. Strengthen the law's response, to strengthen research on prevention and intervention, to support collaboration, and to support information sharing. All of these priorities are equally important, but I'm going to spend a little bit more time talking about the supporting awareness. Our overall conclusions are that efforts to, oh wait, I did the wrong thing, never mind. So in terms of increasing awareness and understanding, there are 3 important levels here. One of the most important is to increase public awareness. This is a problem in the United States. It occurs in cities, towns, rural areas across our country to a variety of children, some of whom have the risk factors that we've identified, some of whom live in homes with their families, some of whom know about this exploitation, some of whom don't. We need to raise awareness of the public. The second thing we need to do is to raise awareness of the adults who actually interact with these young people. Teachers, healthcare providers, social workers, the justice system, both juvenile justice, the criminal justice system, the police, so that they are aware that this is happening, so that they have the tools to identify these young people, preferably to prevent these kinds of harms from happening, but in any event to identify them early, to get them into intervention early. This is absolutely critical. A third group who needs to be reached out to are are young people themselves. Many of these young people who get involved with commercial sexual exploitation and sex trafficking don't even know that they're victims. And so they need to be educated early on, before they get trapped in this system, to realize that this is a problem and that this is a bad thing, to immunize them. How about that for a pediatric word? Immunize them against this problem. All of these educational efforts are absolutely critical and need to be going on at a variety of levels. Strengthening the law's response. This actually takes two parts. The first are develop laws and policies that redirect the victims and survivors of sexual exploitation away from the criminal justice system and into the kind of services that are needed to help them recover and go on and lead healthy adult lives. This is a critical area. There are some noteworthy practices that are going on. Some states are beginning to adopt safe harbor laws, which basically hold that young people who are involved in commercial sexual exploitation as victims cannot be prosecuted as prostitutes or as criminals, but rather have to be identified as victims. These are children who are prostituted. These are children who are harmed. These are not criminals. And that these laws should apply to all children under the age of 18. The other thing that needs to happen in the area of strengthening the law's response is that we need to hold those who promote sex trafficking, exploiters, perpetrators, purchasers. You'll notice I'm not using words like pimps or johns, which are something that we want to avoid. We want to call these acts what they are. They are criminal acts of exploitation, perpetration, purchasing that need to be called what they are, and these individuals need to be held accountable. One of the things that we found in this area is that a number of states are passing laws that actually enact penalties for these kinds of acts. But one of the challenges that prosecutors are running into, as is often true with brand new laws, is that they are uncertain how to prosecute these cases. The judges may not know how to respond to these cases. And so one of the things that we call out for very clearly is to give these prosecutors the tools to develop to use the laws they have to identify these criminals and to hold them accountable. We need to strengthen research on prevention and intervention. You've already heard Richard say that almost no effort has been paid on prevention, and yet this is absolutely critical. The ultimate goal here is that no child should be the victim of sexual exploitation or sex trafficking. This means addressing demand. This means identifying children at risk and developing effective interventions that give them the tools to avoid this kind of involvement. So we need to spend a lot more effort on prevention. And then we also need to spend more time on intervention. And this is going to go into one of my next points. This problem is so complicated, as you've seen from the diagram that Richard showed just a few minutes ago, that there is no way that any single sector can possibly address this problem on its own. And that some of the things that we saw in some of our site visits were programs where people working across disciplinary backgrounds, where teachers were working with social workers, we're working with adolescent health, we're working with juvenile justice, we're working with the police to come up, and non-governmental organizations, to come up with efforts to try to identify and develop multidisciplinary, multi-sector strategies to address these young people's needs, to help them overcome the effects of the severe trauma that they have undergone. And then we need to evaluate the effectiveness of these programs. I'm happy to say that federal law recently required the evaluation of programs funded under federal law, but we need to do more evaluation. This should not slow us up in terms of implementation, but we need to act now but we need to examine what we're doing now so that we can hone our programs and hone our interventions so that we can develop interventions that actually work. It's not enough to do something. It has to do something that works. In terms of supporting collaboration, we call on the Coordinating Council on Juvenile Justice and Delinquency Prevention to take a leadership role in this. This is a council in the executive branch that has secretaries of numerous agencies working together, chaired by the Attorney General, to develop collaborative strategies for dealing with some of these issues. And we really ask them to take a leadership role in coordinating the kind of research and service delivery that we need going forward. Information sharing. We've talked about this a little bit already, but I'll say just a little bit more. There are some crying needs in this area, and also some hopeful paths forward. We need to share information about who these perpetrators are, who these criminals are, so that prosecutors can find them and prosecute them more effectively. We heard testimony from LexisNexis that working with local law enforcement is developing databases that can actually allow identification of perpetrators across jurisdictional lines to facilitate prosecution. We need to develop systems that allow sharing of information about young people so that we can identify young people at risk. This presents some real challenges, but these young people interact with a lot of systems. A lot of them go to school. A lot of them interact with the healthcare system. A lot of them interact with social services. A lot of them are in foster care. And if these entities are able more effectively to collaborate together to share information, it may be possible to identify these young victims earlier so that we can help them more effectively. Finally, and this is something that we call for very strongly, it's really hard when you identify a problem or some person who's in trouble and you don't know how to help them and you don't know how to figure out how to help them. And so one of the things that we call for is for the development of a federally based database that actually allows the teacher, the healthcare provider, the social worker who identifies one of these children immediate, or even the kids themselves, to identify effective interventions that are available right away to help these young children. When I practice medicine, I have a computer at my side. I have Hippocrates in my pocket so that I can find out what drugs I ought to be using, et cetera, et cetera. Those same types of tools ought to be available for every person who's working, who has the opportunity to identify these young children and to figure out how to help them effectively. Finally, in the last 2 pages of the main part of the report, we have a whole bunch of to-do lists for a whole bunch of people. Including Congress, the executive branch, state legislatures, federal agencies, bar associations, academic and research institutions, foundations and NGOs, and not the least of which is the commercial sector. You know, what's interesting is that everybody who interacts with young kids, if they don't identify, they're facilitating. If they do identify, and if they do take responsibility, then they have an opportunity to intervene to make this stop. And it's clear that this is true for every sector, including the commercial sector. So we call on, and we heard some really noteworthy examples from them, so we call on them very clearly to do this. The next thing we want to do, Patty in particular, has developed a video that we want to share with you that is now live on YouTube, which you can share with everybody you want. Send it to everybody. Okay, thank you. So just in closing, I actually shouldn't even do this because that's so powerful. Final thoughts. This is going to require collaboration in a whole lot of sectors. But the time is now. We must act. Thank you very much for your attention, and I'll turn it over to Jennifer.
Thank you. At this time, we will take questions. So if you do have a question, I ask that if you please go to the microphone on either side of the room to ask your question. And again, for those of you joining via the web, you can also send in a question via the text box. Who would like to go? If you can go up to the microphone, please. Thank you. And please identify yourself and your organization.
I'm Eleanor Gayetan with the Coalition Against Trafficking in Women. It was a very moving presentation, especially moving to see you be moved by your own research. So I feel like really it's extraordinary that this report has also turned you all obviously into advocates. My question probably is answered in the first pages of the report that I haven't read yet, but are young people being exploited in the commercial sex industry ever not sex trafficking victims? You're distinguishing in the title between the commercial sex industry and sex trafficking victims. To the law, the Trafficking Victims Protection Act, TVPA of 2000, all minors who are exploited sexually are victims of sex trafficking. So I'm interested in the sort of the title. What are you suggesting about the difference between these two phenomena?
Thank you for your question. What we recognize that there has been discussion and dialogue over definitions and sometimes disagreement in the past decade. What this report focused on were primarily three areas. One is sex trafficking of minors. Two is the prostitution of children. And three is survival sex. We have in the report, in one of the appendices, I forget which one, we've talked through some of the definitional issues, and I think that it would answer your questions about where different studies have used different definitions and how we try to sort through that. But for our purposes, we are looking at any sex act where there is an exchange for something of value. And with this particular focus on, as I said, sex trafficking of minors, prostitution of children, and survival sex.
Next question.
Hi, Samantha Vardaman with Shared Hope International. I'm going to tag right on to Eleanor's question. Certainly, as an anti-trafficking advocacy organization trying to streamline the understanding about child sex trafficking, we grapple with these definitional issues all the time. I was speaking with Jonathan earlier at the beginning of this, saying how we appreciated that was a focus in the report, that there was that clear grappling with definitions. From our standpoint, our concern is that when we distinguish between those three types or those three terminologies, which really all fall under the federal sex trafficking law and increasingly a number of state sex trafficking laws, we have the potential of not collecting all of the data consistently, and we have the potential of not treating all of these victims the same. And so I'm curious to hear how the discussion went with the committee in deciding to distinguish those terms, and then was there a consideration about the impact that might have on the other recommendations?
Sure. Well, I'm not privileged to talk about what the committee discussed and what individual opinions were. This is a consensus report, so where we came out at the end was with a viewpoint that we all agree with. I think it's important to note that part of our job was to look at the evidence. The primary job was to look at the evidence. It is certainly true that federal law has the definition that you mentioned, but it is also the case that some federal agencies define commercial sexual exploitation to include sex trafficking. And so there's inconsistency in definitions. It certainly feeds into challenges with research and data collection, and I think we highlight that in the report. I think ultimately, we felt as a committee that it wasn't our job to sort out different definitions that are, as they're expressed in federal law, state law, different agency definitions, different definitions used by advocates, which may be driven by different motivations. What we felt was important is to identify that discussion, walk readers of the report through that discussion, and recognizing where the issues that arise out of different definitions are, and then focus on what we thought, based on our mandate, were the primary areas that we needed to look at and where there was a need for further examination. And those are the sort of 3 areas that we talk about in the report, and the ones that we focus on, the ones that I mentioned earlier today.
Next question.
You were there first.
Oh.
I thought we were just doing every other. My name is Barbara Odekirk, and I'm an executive branch fellow this year, and I'm placed at the National Institute of Justice. And so I'm very interested in the commercial sexual trafficking literature, and I've been doing a lot of reading through there. And I heard you say during the talk that you are calling on OJJDP to sort of be a coordinator and help organize movements, including both prevention and responding to trafficking. And I'm just wondering a little bit about your decision to call on OJJDP, if part of what we want to do is really start recognizing that these kids shouldn't be in the justice system as perpetrators of crimes.
I'll take a stab at that. OJJDP does things for victims of crimes as well, not just focusing on perpetrators. And as one of the slides showed, there is this coordinating council that brings people together from across the government to try to pull that together. Getting multidisciplinary collaborative action in place here in Washington, in the federal government, in any state government, or any other bureaucracy is difficult. But in anything to do with abuse or neglect, it's critical. And everyone needs to work together, as the report said on this.
Next question.
Hi, I'm Carol Smolinski, the Executive Director of ECPAT USA. Nice to see so many friends in here. We've been working on this issue, of course, for many, many years. And so I'm actually delighted to have the report. I have a couple of questions, but let me just comment first that I understood when the IOM was commissioned to do this report that it would really cause a great increase in focus on the issue of commercial sexual exploitation of children and policy in the United States. And so I'm expecting to see that now. I just, obviously not having read the report yet, I support the recommendations. I think they're really right on from what I can see. I'm really excited about this. So 2 questions. One is just what happens from here? What do you see will boost the highlighting of this issue in the United States at the state level, federal level, policy, research, everything that you're recommending that has to take place? What's your role, or what do you at least see happening from here? Because I want to make sure that happens. Another quick question about boys, and I'm wondering, because we just published a report about sexual exploitation of boys in the United States, and what we're putting a focus on is how even more stigmatized than the issue of sex trafficking and sexual exploitation of girls is, that boys are really off the agenda. So I'm just wondering if you talked about that at all. And then finally, I just took a quick look on my YouTube app on my phone and didn't see the video. So I hope that you will give us a way that we can find the video that you just showed. I guess you said it was on YouTube?
It'll be on www.iom.edu.
Oh, I see. It's not on YouTube. Okay.
I'll link to it.
Let me take the 2 of them. First of all, we do talk about boys, and we do realize it's a tremendous issue. And so they are definitely what we're talking about. One thing about IOM committees is that when they deliver their report, they're done. And so, we've done the very best job that we can to develop a set of recommendations that we enthusiastically hope that others will pick up the ball and run with. I know what I'm dreaming about, but I know what the committee what happens with the committee, which is that it sunsets. Always makes me sad, but it's true.
I think that your question, Carol, about what happens next is an absolutely critical one, and I think that if all the people in this room and all the people on the webcast can take the report or whatever portions of the report speak to their audiences and really make sure that those recommendations get out and that the advocacy to make sure those recommendations are implemented is conducted, then we can have a ripple effect from the report out to the larger society at every level, from the national to the low, the smallest communities, and that would certainly be a hope that would occur as a result of the dissemination of the report.
I'll make one comment, which is that dissemination efforts are actually underway. That's one of the things, the next phase, which isn't a committee activity, but an IOM committee, is to develop a variety of dissemination activities for this. So I think OJJDP has been really forward-looking in thinking and really providing money to think about dissemination so that this can have the biggest impact that it possibly can from this report. And then, and certainly we individually hope that it's going to have a huge impact.
Thank you. I'm going to actually go to my first web question really quick, and then I'll get to you. The question is, what about prevention efforts to children so that they do not turn into exploiters and traffickers?
Well, yeah, all right. We think that's a critical question, and we haven't seen any. It's a critical area of focus for research because we didn't see any evidence that would let us tell when those of us who are pediatricians walk around in a nursery or take care of children in child care, or teachers taking care of children, that you could look and tell who's going to become the exploiter and the trafficker. It is that kind of longitudinal research that is critical in all of these areas, because ultimately we have not only victims, but we have individuals who are behaving as adults in ways that were probably in part genetically determined, certainly environmentally and social influences on all of them, and how those come together and move along, we don't have the data yet to suggest, but it would be fabulous data to have.
If I could add briefly, it's one of the reasons also why we call for a multi-sector response. Certainly law enforcement plays a key role in pursuing and arresting purchasers and other exploiters. But as Dick said, we're looking long-term as well. And so we saw in our research and site visits, we saw an example in Chicago of a curriculum aimed at teaching boys more constructive, positive, healthy behaviors and attitudes. And that hasn't been evaluated. A common theme that you'll hear today is that we need to evaluate these programs, but it's a noteworthy example that merits a closer look. And so there are other sectors that might play a role in addressing some of the demand side and preventing over the long term as well.
Your question.
Hi, I'm Deborah Whitcomb. I'm a visiting fellow with the Office for Victims of Crime in the Department of Justice. And my role there is supposed to be to help make sure that our training and technical assistance efforts are evidence-based. So I'd like to follow up on your comments there about the absence of evaluation so far for many of the interventions that we're looking at, and yet the conundrum of wanting to create a database of interventions for providers, practitioners in the field to tap into. It's one thing to do that in medicine, where there has been a lot of research on different drugs and other interventions. It's another thing, even in the criminal justice system writ large, that there's not much evaluation. So how do we create a database that is useful to the field where we really don't have the foundation behind it to say that these interventions work.
Sharon, want to talk to that? No?
I acknowledge that this is a conundrum. And so, and I have to say that you gave great props to medicine, where we sometimes have less evidence than you think we do. But I think, I think that the way that we're going to have to go forward with this area is, in terms of creating resources, to be honest about what their limitations are, to pick up some of the call for evaluation of the responses of the efforts that are underway, and then just to sort of do this in a parallel process. I mean, what I think we can't do is to say, well, we can't do anything now because we don't have the data. That's not a solution. So what is a solution is to be honest about the quality of the data that we do have, to insist on valuation, put it out there, and then as we get more evidence, then refine what it is that we can do. I think that's what we have to do, because every day we don't do something, children are being victimized. I mean, and so I think that, we didn't find a lot of data, but we had some data. So there's something to move from. I just think humility about what we have, a call for evaluation, and moving forward to refine the tools that we do have to make them better has got to be the way forward, because standing still is not okay.
Thank you.
To build on that, when we talk about collaborating across sectors, we're also including academic institutes and research institutions. One of the things that we heard in testimony from service providers is that we've collected a lot of information or data, but we have no time. We don't have the time or resources to evaluate that and analyze it. And this is why partnerships across sectors are so important, and connecting people so that the people who do that well can do that, and the service providers can learn from that evaluation. I think it's related to another recommendation of ours, which is having entities across different sectors identify their core capabilities. What is it you do well, and figuring out how that fits with the solution. So healthcare professionals do what they do well, educators, school nurses, law enforcement, figure out what each sector does well, and I include in that researchers that maybe can't provide the frontline service, but they can help with the evaluation. So maybe we need to do a better job connecting some of those partners.
We have a few questions that came in from our webcast. The first is from Maya Brewer from the Substance Abuse Free Environment in Richmond, Virginia. She asks, is there any consideration for young adults over 18 who've been entangled in sex trafficking since they were minors? Sometimes individuals are in the system for years before they are discovered, and they really never get the help they need.
The committee's charge was to look at minors under the age of 18, but we did address in the report the fact that these young people go on to be young adults, and that the problems that they experience as a result of the crimes that they were victimized by when they were minors don't suddenly end at the age of 18. In addition, there are young people who may be victimized for the first time when they're young adults, age 18, 19, 20. And although we could not delve into that aspect of the problem in depth, the report does acknowledge that there needs to be attention to that age group as well as to those who are victimized when they're under the age of 18.
Here, another question from the web is, can the panel give us some characteristics of the most vulnerable populations, such as age, sex, ethnicity, urban versus rural, and socioeconomic class?
I think you saw in that diagram, we really are following an ecological model here and really trying to identify the risk factors. We saw individual, family level, peer and community, societal macro level factors all being involved. We did highlight some groups based on our research that were particularly at risk. A lot of the children that we learned about were involved in child abuse and neglect, so they're involved in child protective services for one of those reasons. Some of them had been disconnected from their families and were without stable housing, or they were homeless. We also had children who were moved across different systems and not sort of having a consistent support system, right? But at the same time, in addition to those types of risk factors, we also saw kids who were in families who were involved in sexual exploitation and trafficking while living with their families. Either their families may or may not have known about it. So it really occurred across geographic areas, across socioeconomic status, across race and ethnicity, across age levels. So even though we did identify some risk factors, we really wanted to point out that it really occurs everywhere.
Next question over here.
Oh, thanks. I'm wondering if you're going to be willing to do this, but I'm curious if you, just as individuals, have talked about or have any ideas on why you think such an important and difficult social issue has been so far off the agenda in the United States, that it's just not something that we have talked about, that, you know, there's so much to do. Why has it been ignored for so many? I'm just wondering if you guys talked about that. You're, you know, been thinking about the issue for a couple of years. And
we did talk about it as a committee, and of course we can't talk about now what we talked about as a committee. But as someone who's done a lot of work in the field of child abuse, I think, and in the preface to this report, we went back a little in history. There's a phrase that a British psychiatrist used called gaze aversion. And given the opportunity to turn away from things that are unpleasant or difficult, most people, most agencies, most societies, and most governments will do so, and have done so for years. The interesting thing you said is, my observation is we do a lot better at addressing and raising money for health problems than we do for social problems in this country. And one of the interesting conundrums is when you have so many problems that are in fact socially based that you need to address, how do you raise money for them in a society that's more interested in its own health than its social problems? It's hard.
Next question.
I know I can speak for many advocates, including CATW, Equality Now, Shared Hope, ECPAT, Hunt Alternatives, Demand Abolition Project, in commending you for paying attention to the demand side of this issue. That might be the most intellectually, conceptually forward-leaning aspect of your report. You mentioned LexisNexis as one specific project that's doing something new in bringing accountability to perpetrators. Were there other examples you would flag as very important in confronting demand? And last point, thank you to OJJDP and specifically Catherine Pierce for for commissioning this report.
LexisNexis gave a presentation, which is why they were included in this. I think so I can say that that's sort of what's in the report. I think that I am hopeful that there are other examples. We also talked about the financial credit card company that was very helpful in this regard. I think there are real opportunities here to reach out to the commercial sector. Certainly the activities of ECPAT we highlighted a lot, and trying to reduce the opportunity for this to occur in our hotels and taxis and other things like that. We talked about Homeland Security and their position against this kind of activity on Amtrak. So we wrote about what we wrote about. I think there are a lot of opportunities going forward.
It looks like we are out of questions at this time, and we're nearing the top of the hour. So with that, I'd like to conclude today's briefing. Thank you again for joining us. And as a reminder, you can download the report, the video, and other related materials at www.iom.edu and www.nas.edu. And again, another thank you to the committee. We didn't say this at the beginning of the briefing, but they are all serving pro bono on this committee, and they've given a lot of time and service. So again, thank you all.
Okay.
Okay.